All right, guys, so the next stage, once you have a suspected spinal injury, you provided manual inline stabilization, you've measured and applied a collar, is to now actually get the patient from the ground onto the stretcher. So we use what we've got here, which is called the Combicarrier 2. So this is a spine board / scoop stretcher. So it's 2-in-1 type stretcher. Again, some of the services you might be working with may have purely just the spine board, or they may actually have a scoop stretcher that they carry both of. But this is really good in the sense that you can use it for both purposes, and then you're only carrying one piece of equipment rather than two. This board is really quite light. It's designed to be able to carry by yourself when you're having to go to where your patient is. And the board, how it's designed, where you've got all these hand grips down on the top and along the sides, is designed to be able to lift with just two people. So if it's just you and your partner and you feel comfortable with the weight of the patient, you can actually lift this board with just two of you with how this is designed. Now, when Ian's got manual inline stabilization with our patient here at the moment, we've applied a soft collar. The next step now is to get the patient from the ground onto this Combicarrier. And we're going to do it in the way of splitting this board in two. That way we're minimizing the movement. Rather than having to completely and totally log roll our patient 90 degrees, we only actually have to roll about 15 degrees. It's a very minimal amount that we need to roll. We pop one side of the board under, we repeat that going the other way, and we're reducing the risk of potentially injuring our patient more, or making the potential spinal injury that he's got worse. So how we split this board is, I'm just going to spin it around this way for you to see. You've got this locking mechanism just here. So it's a little grey piece, you pull it across, which comes like that, and then you just slide the board outwards. So you do that on both sides, and we'll do the other end in a moment, and it splits across just this way. So I'm just going to pop that back in for a moment. It locks in just by pushing it back in onto it. You don't actually have to push anything to lock it. You'll hear the locking mechanism done, clip back in. So what we'll do is, I'm just going to lay this down beside Mark here. I'm going to get other two people to roll. So you do need 4 people to do this. So you have somebody on manual inline stabilization. You'll need 2 people to roll your patient, and then you'll need a 4th person to actually slide the board in underneath. So Jens and Lucy are going to come and help us do this right now. So Jens and I will split the board first. So one side there, one side there. Jens will take it around. Don't pass it over your patient. Make sure you're going around. And now, as you can see, now that we've split the board, it doesn't matter what piece is on what side because it's identical. But we are going to come in from this side first because we want this bigger part here to be underneath the patient's shoulders and head. Whereas if we were to put that in there first, up on the patient's head and shoulder, there's not a lot of support. So it's really about using this section here. So generally, you'll actually come in from the patient's right-hand side. So I'm going to have the board here. Really important to note that whoever is managing the C-spine and the airway is in charge of the roll. So we're not going to do anything until Ian gives us that count. And you can 3, 2, 1, 1, 2, 3, ready to roll. However you want to do it, but Ian's going to communicate that to us first to make sure that we're aware of how he wants us to do it. Jens will be supporting underneath Mark's shoulder here and then down near the hip. Get a good grip of clothing. Lucy's then going to cross arms with Jens, good bit of clothing around again the hip, and bring his legs in together and supporting around there. So on Ian's count, we're going to roll, but we're only rolling 15 degrees. Once he's rolled, what I can do as well, if we're suspecting anything, I can have a quick feel along the back, along the spine to see if there's any tenderness, if we're feeling any injuries, any bleeding or anything like that, and I will slide the board underneath. All right, Ian, it's up to you. It's your count now, mate. Let me know when we're ready.
On my 3, 1, 2, 3, roll.
Yep, that's enough. So I'm going to have a feel along the back. Patient can tell us if there's any pain or anything. There's no blood. I'm now going to slide the board. Just lift the head a little slightly there, underneath this way. All right. So now we can roll the patient back on Ian's count.
On my 3, 1, 2, 3, roll.
There we go. So our patient's now half on the board. Now we're going to repeat exactly the same thing, just rolling the opposite way. So for me this time what I'm going to do is I'm going to put this section here, slide in underneath the shoulder first and have this end clipped in. And then basically what we do is scissor the board closed in together and we'll lock the bottom. But again, we're not going to do that until Ian's count.
Okay, on my 3. 1, 2, 3, roll.
Yep, that's enough. That one's locked in. Come down through here. We may need to lift the leg slightly. We're now clipped in.
1, 2, 3, roll.
There we go. And now our patient's positioned on the board. Ian's still maintaining manual inline stabilisation. So the collar's purely just there as somewhat of support, but a reminder that there's a potential spinal injury. So Ian's still not going to let go just then. The next step is now to strap our patient in. All right, so the next step is now to get ready to actually lift the patient, but from a safe aspect, we want to make sure our patient's secured onto the board. The Combicarrier comes with 4 of these style straps. So it's like a seatbelt strap. So this is the buckle where we plug it in, and then the longer strap here, which just clips in exactly like the seatbelt. How we attach it to the board, we have this this connection here that just clips over the top of the little yellow lugs that are within the handholds. So when we strap the patient in, we actually go across the chest. So 2 straps will come across the chest, similar to your stair chairs that we've already shown you. 1 across the hip area. And then the other one we can use a couple different ways. One, it can just go directly across the legs, or if we think the patient may have to go on a bit of an angle, depending on where we're carrying them, one of these straps can actually be secured around the feet and back so we can actually hold the patient on there. So with our patient, again, making sure that they understand exactly what's going on. If the patient is unable to hold their hands in by themselves and they're hanging out, we can have the patient's arms strapped down underneath the straps. But again, it's patient dependent and you just have to make that judgment at the time. All right, so I'm going to get Lucy and Jens to come and strap Mark onto the board. Ian's still holding manual inline stabilisation at this time. So I'm going to hand these ones over. So again, top straps. So you go this one. Yep, that's okay. So it goes just underneath the shoulders. So you just need to be very careful not to maneuver the patient around too much. That's it. And it just clips on. Those straps then come up and over the shoulders and it will go across the body. So we're going to come up through here. There we go.
That's cool.
That's it. Good. So that's the top straps that go over the top of the shoulders. Then the locking mechanism clips in. Again, it just clips over the little yellow lugs on the handholds. They can be quite tight sometimes, so you do need to be a little bit careful. Clip in and then tighten, not too tight that we're restricting the patient's breathing, but tight enough that if it does happen to tip a little bit, that the patient's not going to slide.
Tighten a little bit later.
Yep. The next one we go across the patient's hip area. So same thing, 1 clips on one side, Lucy will clip in on the other side.
Around the hips.
You can have these pre-strapped as well, so some services will allow you to have the actual straps connected already. Again, patient dependent. If you're unable to have those straps based on where you're working or whatever the reason may be that you haven't had them on, this is a method to be able to put them on. There we go. So across there and tighten. Make sure nothing's in the patient's pockets. That's it. And now we're going to go around Mark's feet. So this is just in case if we do go on a bit of an incline, that the patient is okay and strapped in through there. Yep. If you need to, you can use some towels or blankets to put some padding in between the patient's legs, in particular if they have a leg injury. You basically come across the patient's legs, around the bottom of the feet, cross back, and then strap down. And making sure the straps are tucked away. Ian's still maintaining stabilisation there. And that there, now your patient is ready to be able to be lifted and moved. So Jens is just going to finish tidying up the straps. So we don't want anything hanging out of the way, just in case they do get caught. Good. And now Ian's still holding manual inline stabilization.
Not doing it too tight.
All right, and that's one method of being able to strap your patient in. All right, guys, so now that we have the patient being stabilized with manual inline stabilization, we've measured and applied a soft collar, we've positioned them on the Combicarrier and they're strapped in, they're now ready to be able to move. So basically what we can do, if we had enough hands, Ian would be able to stay holding manual inline stabilization, or the alternative is to be able to actually support the head either side so Ian can let go and then assist with actually lifting the stretcher. There's a few different ways you can do it. You can get sandbags, you can get pre-made head blocks, or you can actually just use a blanket. And how we do that is we pull the blanket out long ways, we slide it underneath Mark's head, and we roll it in towards, so it's nice and snug either side of Mark's head, and then we can tape it down. So that's the method that we're going to do today. So Ian's still holding manual inline stabilization. I'm going to unfold the blanket. I'm going to give Jens half through here. So we're just going to slide underneath Ian's hands. That's it. Keep going, Jens. Pull through. Keep going, keep going, keep going. A little bit further. So we're about halfway. Then what we're going to have to do is very slightly lift Mark's head off of the board. It's only very slight, just so we can slide the blanket under, and we're going to do that on Ian's count.
On my 3. 1, 2, 3.
And we can slide it underneath. It's nice and firm there. And then what Jens and I are going to do from the outside is folding it down underneath itself and basically roll it in this way in towards Mark's head, all the way till it's nice and firm. There we go. Then Ian's going to hold either side of the blanket just for now. There we go. So we're still not moving our patient. And then we're going to tape it down. So just using just some normal medical tape. Find the end there. We're going to go across the forehead, then also across the chin or the actual collar. So you can either tape it just directly to the blanket, or you can go from the board. So I'm going to get Ian to move his hand out of the way. I'm going to stick it onto the board there. I'm going to give that side to Jens.
Just hold his head. You're going to choose a
There we go. So what you can also do, you can put a little bit of padding, a combine or something underneath the forehead, or you can just fold the tape on itself so it's not stuck to the patient's skin as such, but if you need to, that's okay. And we're going to do exactly the same thing here. I'm going to go over the collar, down to the board. And then that way, we're okay. Ian can now let go because we're providing additional support for Mark's C-spine. And now we actually have additional hands to be able to safely lift the board. All right, guys, the next step from here is to actually move your patient from the ground onto your stretcher. It's really important to consider where you're going to position your stretcher. As you can see at the moment, we have our stretcher positioned at the patient's head, which we can just lift, and then all of us walk either side of the striker straight onto the stretcher. You can also do that at the feet of the stretcher, or if you of the combi, sorry, or if you can't position either the way there, either side. But it's really important that you formulate that plan and that everybody understands where it is you're going to be moving. Really important to consider safe manual handling, so safe lifting techniques. As we mentioned before, this Combicarrier is actually designed for 2 people to lift it. But if you're not comfortable with that, the more hands, the better. So we're going to be lifting with 4 people today. Again, whoever's at the head is going to manage the commands. So Ian's going to give us the commands when we can lift and move. It's really important, again, that to clarify who is doing that, and only one person is ever going to give those commands. All right, so Ian, when you're ready, so we're going to get a good grip onto the stretcher, safe manual handling.
Everyone ready?
Yes.
Yeah. On my 3. 1, 2, 3, lift.
There we go. Just walking down either side.
On my 3. 1, 2, 3, lower.
And lowering our patient down there like that. Okay guys, now that we have the patient on the actual striker stretcher, we need to consider if we're going to be able to leave the patient on the combi or if we have to remove them. If you have an extended transport time, generally anything over 20 minutes, you actually want to take them off of this board because we need to consider pressure sores. How we do it is effectively the reverse of how we got the patient on there. So first step is to make sure you undo all your straps. So we're going to do that first. You release that there. And off to the side. So once the straps are off, Ian is now going to take hold of C-spine again, just considering that if you've got the head blocks or tape, that it's not taped to the actual combi, and that Ian's holding that. Because we are rolling the patient again, we're having to actually do the manual inline stabilization, and Ian will be giving us the commands. As I said before, it's exactly the reverse of how we put him on. So Jens and Lucy are going to roll the patient again towards them. I'm just going to unclip the board and I'm going to slide that out. So Ian is going to give us the commands to do that.
Okay guys, everybody ready?
Yep.
On my 3. 1, 2, 3.
That's
roll.
it. So I need to unclip here, slide this part through here, unclip up here.
On my 3. 1, 2, 3, roll.
There we go. So board is out of the way, so we make sure that we're not going to trip over it. Swap sides. And we're going to do exactly the same thing again.
Everybody ready?
Yep.
Yeah.
On my 3. 1, 2, 3, roll.
There we
On
go.
my 3. 1, 2, 3, roll.
Feel better.
Now that our patient is off the board, Ian's going to hold tight until we actually strap mark in, and then we can move from there. So we would do exactly the same as what we've done before with our straps for the striker. There we go. Another one here.
Process here.
Side rails will go up.
Just going to clip these ones in here. Just lift them up. Hands up a little
There
bit.
we go.
Yours got there. Got the other one there.
Yep.
Don't go too tight.
There we go. Then once we're happy the patient's positioned on the striker, we've got either manual inline stabilization being held again, or the towels, blankets, or your head blocks or sandbags. We're now ready to actually move our patient into the back of the ambulance.